Paul is questioning Dr. Anthony Fauci's record and ability to follow the science after missing the mark with pandemic guidelines time and time again. One America's Hines has more from Washington.
In the aftermath of these emails from Dr. Fauci being released, he has said that he was on the receiving end of, quote, completely inappropriate, distorted, misleading, and misrepresented attacks. I was wondering, sir, what do you make of that statement from Dr. Anthony Fauci, who is the director, or has been for the last 40 years, I guess, of the Institute of Allergy and Infectious Diseases, in light of these emails showing he appeared to support gain-of-function research?
You know, I think we've only ever wanted to talk about the facts, the science, and judgment. I think it shows poor judgment that he still thinks that the Chinese scientists and government can be trusted. It shows poor judgment that he's been an advocate of gain-of-function research. It shows lack of insight that he still denies that he was funding gain-of-function research when the actual papers from the scientists, the Dr. Shi and the Wuhan lab, in her papers, she acknowledges his funding in papers where she was taking an animal virus and enhancing its ability to infect humans. These are all real questions. They're valid questions. The other big question that I've been really pushing in the last couple of days, because, you know, India is suffering more than any other country right now. They seem to have the most infections, the most deaths going on, and there's a lack of vaccine there. But there's a really important public policy question. It's a big public health question. Should you be using or wasting the vaccine on people who have already been infected? And there was a big study from Cleveland Clinic this week, 52,000 employees saying that, guess what? If you've been infected and didn't get vaccinated, or you got vaccinated, they had about the same results. There really wasn't an improvement for people to get vaccinated who already have the disease. What does that mean? Our vaccine can go much further in places like India if we'll not vaccinate people who've already been infected. They should be at the back of the line if they're in any line, but that could save thousands of lives. And that's the science. That's not us evading the science. That's saying us to Dr. Fauci, let's obey the science. But he's advising India to vaccinate everyone. They're using the same policy we did here. And I think as a consequence, people will die who are waiting in line to get the vaccine.
So what you're saying is Dr. Fauci's record on this is not good. He's been wrong before. And what you're saying is that he's probably wrong on this point. You are someone who's had COVID-19. You chose not to get vaccinated for that reason. And so what you're saying is if we perhaps ignore him, have some people who have had COVID, not worry about being vaccinated, there'll be more for other people.
Well, I think medical decisions should be individualized. So, for example, I made my decision, but if you made a different decision, that's completely your right to do so, and people will come to different conclusions. But let's say you have a 12-year-old son or daughter at home. They had COVID a month ago. They had a positive test. They barely got sick, and now they're better. And the government's saying, well, you're no longer going to be able to go to our schools if you don't vaccinate. And you're like, well, show me the science that says my kid doesn't have immunity. And then the government says, well, there's some rare cases of myocarditis, inflammation of the heart from the vaccine. They are rare. I'm not trying to scare people. But if your kid just had it and had immunity, isn't it incumbent upon the government to sort of prove to you why? Instead, people like Dr. Fauci, who are the ultimate elitist, they say, everybody gets the same. No thinking. You should not be thinking. I'm doing the thinking for you because the common man is not smart enough to make these decisions. And it's really the difference between the left and the right. I'm from the right, but I have a great deal of respect for people who disagree with me, people who want to make other decisions. As a physician, I would give advice, but I would never tell you what to do. Throw out all the facts. Let's have an open debate. And really, two people might make completely the opposite decision based on facts. But we're not hearing the facts. Dr. Fauci says he's going to be smart. He's smart enough to make these decisions without any input from us.
Senator Rand Paul of Kentucky, thank you for talking to us on One American News. It's good to catch up with you, sir.
Thank you.